You swing your legs out of bed, your foot hits the cold floor, and immediately a sharp stabbing pain shoots through your heel. For years, standard medical advice has labeled this plantar fasciitis, suggesting your tissue is merely inflamed. But if you have been taking ibuprofen and waiting for the swelling to go down, you already know that passive approach usually fails. This lateral view highlights exactly where that pain originates. Right here at the base of the heel bone is the insertion point for the plantar fascia. Switching to a bottom-up view, you can see the scale of the tissue involved. The fascia is a thick, durable band stretching all the way from that heel connection through the entire arch of your foot. When treatments focus solely on inflammation, they overlook the complex structural role of this tissue. Finding a lasting fix requires looking closer at how the foot actually handles the pressure of every step. To understand why it hurts so much, picture the bottom of your foot as a bow. The plantar fascia is the tight bowstring snapping across the bottom, forced to independently hold up your entire body weight. Every time you stand or take a step, heavy downward forces push into the arch. That bowstring pulls taut, generating intense horizontal tension along the bottom of your foot to keep the arch from collapsing. When that tension exceeds what the tissue can handle, it physically begins to tear. The intense stabbing you feel is the result of thousands of microscopic tears caused by chronic mechanical overload to repair those mechanical fibers. Before you can rebuild the arch, you have to get through the day. Acute pain relief needs to accomplish two tasks simultaneously: quiet the screaming nerve endings and physically stretch the damaged fibers. This triage method hits both targets. Roll your arch over a frozen water bottle for 10 minutes. The extreme cold numbs the nerves, while the rigid contour pushes upward, stretching the tight, spasming tissue. It is a simple tool, but it successfully manages your immediate suffering so that you have the required mobility to begin the permanent cure. That brings us back to the morning agony. While you sleep, your foot relaxes and the fascia physically shortens. The moment you stand up, your body weight violently stretches it back out, ripping the tissue open all over again. Perform this clinical maneuver while still under the covers. Rest your foot on a rolled towel and firmly pull your big toe back. This engages the windlass mechanism, winding the fascial tissue tighter, pulling it into a maximum stretch. By pre-stretching the fibers with your hand, you safely lengthen the tissue without introducing the crushing downward force of your entire body weight. Performing this routine every morning physically breaks the cycle. You stop the violent daily re-injury, giving those micro-tears a chance to stay closed. With the daily tearing stopped, recovery often stalls because of the most common advice given to patients: total passive rest. Staying off your feet entirely will not fuse those structural micro-tears back together. Modern clinical recovery relies on progressive loading. To rebuild the tensile capacity of a physical band, you have to deliberately expose it to controlled stress. Its capacity to handle heavy, dynamic stress is the only way to permanently heal the damage. While you are in this active rebuilding phase, your environment can still derail your progress. Walking barefoot or flat-footed on hard surfaces leaves the weakened tissue completely exposed to heavy impacts. This bottom panel shows the necessary adjustment. Introduce a shoe with an elevated, supportive profile. Notice the clear cushioning structure beneath the heel. This acts as an external mechanical scaffold, securely holding the foot and absorbing the shock so repairing tissue doesn't have to. The protocol is clear. Building the physical structure of your arch addresses the root cause of the injury. It is the final shift that allows you to walk without wincing and finally get your stride back.